So I'm David Swain. I'm a dietitian at Basingstoke Hospital. I was employed in 2003, all thanks to the pseudomyxoma unit who employed myself and Priya Mistry, who's a pharmacist. And we were employed to set up the nutrition team. And so that happened back in 2003. We were basically employed because all patients who undergo cytoreductive surgery go on to intravenous nutrition post-surgery. So after surgery we'll give patients food via their vein, and we normally do that for about up to 13 days. So prior to surgery we'll see the patient, we'll weigh them, do their height. We also do a measurement around their arm because a lot of these patients can be quite distended, so we have to get a good idea of actually what their proper weight is without the tumour. And then from that we work out how many calories and protein and how much micronutrients they need. And then we start feeding the day after surgery. So we normally feed, as I say, for a couple of weeks. We gradually build people up after surgery, so they normally start on sort of water and then half cups of coffee, and then what we call free fluids, which is soup, jelly, ice cream, and then build up to diet. We then gradually wean down the amount of intravenous food that we give while we build up their diet. And then we see people after that in case they have any sort of special nutritional problems. So some people might have their stomach removed, and we have to sort of like try and make sure they have little and often, and help them with that. Some people might have stomas, so sometimes they have to go on special diets, especially if they've got high output stomas. So we pretty much deal with all the nutrition with the pseudomyxoma patients.
Do you have an ongoing relationship with a lot of patients after treatment, after surgery?
Yeah, about a year ago I actually moved over to the pseudomyxoma team completely. So now when Vicky and Sue, who are the nurses, and Linda follow up patients over the telephone, if they're concerned about somebody then they contact me, and then I can phone them and talk to them on the phone, and if we need to prescribe anything then I can contact their local GP.
What's the longest after surgery that you've been talking to someone?
Probably about half a year or so, but that's because I've only been in the sort of the post to follow up patients for the last year.